How's it going? Jimmy from the RT Clinic back again. Today we're talking specifically about some of our midlines and some things we've run up against and some education for the nurses. So let's cut to the intro. So by now, you're pretty familiar with our midlines we have. These are the 4 French 17 gauge catheters. This one's a little bit bent because it's my demo, but these are the ones we're using in the hospital. So I want to go over a couple things real quickly about the midlines with you. So we've been working on this midline project since about April, and we've got a lot of RTs that are doing it. Some aren't trained yet, but we have enough to really cover the majority of the hospital. So just so you know, the respiratory therapists, charge therapists are doing this during extra time. We don't have FTEs for this yet. We hope to in the future, but we look at it as a great patient satisfier, a great nurse satisfier, and just all around great for everybody in the hospital because patients are getting really good access in these cases and the number one case has been poor venous access is why we're putting these in. So I just want to go over a couple things in ordering them and a couple other things that we can look at them compared to a PICC line and how you care for them. So let's get started. So it's really important when getting the order from the primary physician for this midline insertion that you also ask at the same time if it's okay to draw routine labs from this midline. Now, we need a one-time order for every midline, and that can be put in whichever way you want it to be. It can be put in as a nursing message or whatever, but once the physician okays routine blood draws, we can now use it to draw blood as well as infuse medications through it. There's only one caveat that we have when putting these in, and sometimes we have to check the patient's GFR. If it's less than 60, we need to call a nephrologist, or if they don't have a nephrologist on board, we need to ask the primary care physician to make sure it's okay if we place this line, because there can be some minimal damage done to vessels, and if we're planning on putting a dialysis catheter in them at any time, we're going to need to have that as a good vessel. So we have to get a second kind of okay if their GFR is less than 60. Respiratory therapy will take care of that, and they'll notify you if we have those cases. So if we're looking at care of the midline catheter versus a PICC, side by side, they're absolutely the same. And you're going to say, well, midline catheters aren't central lines. No, they're not. But we are overkilling it, and I think that's a good thing in this case when it comes to the care, because we want it so it's not a totally different form of care or a different plan of care than you would for a PICC, so that it can be very consistent. So you see these lined up side by side. We have midline, we have PICC line. Midline, we have a daily CHG as in PICC line, and I'll go through the list here. The 7-day sterile dressing change, the dressing date and time will be put on the dressing when RT or the residents place this line. We also do arm circumference, and from the INO flow sheet, that arm circumference is 2 inches above insertion site. That's checked every shift. The respiratory therapist or the inserting person will be putting in that initial measurement of arm circumference. We use alcohol swab caps, just like you would with a PICC. We're going to use those in the midline. And then probably even more important than with a PICC, the midline definitely needs to be flushed every shift. So every 12 hours, every shift, it needs to be flushed if it's not in use, because midlines have a very high propensity to clot. So it's really important on there that you're flushing that. And the best way to flush it is push-pause method of 10 cc. So you push 2 mLs, you pause, you push 2 mLs, you pause. So it causes some turbulent flow, which can help to keep those things open. But it's really important to flush those midlines as it is with the PICCs. So to go back to blood draws, and this is one of the things that midlines are really great for, we get that one-time order is required for blood draws, and midlines cannot be used for blood cultures. And the thing is with midlines, not all of them are great for drawing blood. There's a couple of them that we put in that they just don't draw blood well. And so you're going to know on your patient if their midline draws blood well, because we're going to pass that along to you. But then also on the tag there, as you see on the right hand side of the screen here, the tag that hangs in the rim on the IV pole, it's going to say okay for blood draws. That means it drew really well when we placed it. One other thing that's not so great about midlines is sometimes they can stay in by the FDA. They can stay in for up to 28 days. Now, 14 days is really about the best area for keeping them in, not much longer than that. But usually 5 to 10 days, your line may stop drawing blood because there's some fiber and sheath that kind of builds up around this catheter, and it may stop drawing blood at that time. Now, in those cases, you still can infuse medications through it as long as it's patent and flushes well. It may just not draw. So usually we can draw really well for maybe 5 to 10 days. After that, you may lose the ability to draw blood, but it's still a good line. If at any time you have a question, like is this line in or not, you can call respiratory therapy. We'll bring an ultrasound up. We'll take a look at it, make sure it has proper placement. These rarely come dislodged because they're so long, but they definitely could. So calling respiratory therapy so that we can come up and see if it's migrated or infiltrated will be right on. Thanks for watching. Please reach out if you have any questions about midlines at all, because midlines are a part of the excellent patient care that we all strive to give here at Union Health. See you later.